One of the clinic's sort of focus areas that we're wanting to put some time and effort into at the moment, and that's looking at cardiovascular health, which is a fancy medical way of saying heart health. One of the effects that we've seen over the last 3 years of COVID is with significantly reduced amounts of face-to-face consulting. There's various things that are missing in a lot of patients' medical records. We don't have enough blood pressures for our patients over the last 3 years. We may not have a current weight, a current height, current smoking status. So there's kind of been a vacuum of information that's developed during the last 3 years of COVID. And obviously we're now starting to move beyond COVID, and we're starting to get back into a space where we're really wanting to look after preventative healthcare. So these are things that we can do now to protect your health in the future. We know, most of our patient population here is Māori and Pacifica, and we know that we have higher rates of heart disease. As a Māori man, I know that in my whānau, the rates of heart disease we see are not the same as the rates that you might see in a Pākehā European family in New Zealand. So we're really wanting to get proactive in this space, and one of the ways that we can do that is a cardiovascular risk assessment or a heart health assessment. There's various pieces of information we need in order to do this. So we need a height, a weight, a blood pressure. We need you to have a blood test, and we also need to gather some information about your whānau's health history, particularly where heart attacks and strokes are concerned. If we have these things, we can actually get an accurate sort of risk assessment of, well, what's your individual risk over the next 5 years of having a heart attack or a stroke. The important thing about that risk number is, for those of you who might be crossing higher thresholds of risk, we can actually do things about that. We can say, hey look, you actually got a 1 in 7 risk of having a heart attack or a stroke within the next 5 years. Some of the risk factors that are creating that risk for you are your elevated blood pressure, your high blood pressure, might be your high cholesterol, and we can actually do things. We can start medicines, we can assist you with lifestyle change, exercise, weight loss, in order to lower your risk. So from my point of view, cardiovascular risk assessment, heart health assessment is one of the most important kind of preventative health measures that we undertake in South Auckland. And I'd really, really encourage you, Māori men, Pacifica men and women, to come in if you're invited to partake in heart health assessment. This is one of the most important things we can do to look after your health in the long term.